Well, hello, fellow people. I'm not sure why this random thought popped into my head, so I thought I would just record it. I just want to keep people aware of what happened back in 2020. So, YouTube, I'm not fabricating any numbers here. This man is holding up this sign. He did this back in 2020. And what it's saying is the survival rate of each age group when this whole thing hit. Okay? That's him, not me. It is confirmed. He's sourcing it through your own government agencies. You can go ahead and screenshot this, look it up, you'll find it for yourselves, okay? So, the reason that I want to touch on this because I feel like there is such a massive Edward Bernays effect going on in society right now. I don't ever want this to happen again. I don't ever want masses of you to fall for this mess again because it was a mess from beginning to end. So the random thought that popped up in my head is to show you guys that they made literal guinea pigs out of you. They treated you like lab rats for free. This is something that I know I thought most Americans knew this, but apparently you don't. That you can get paid to take a new drug, an untested drug, okay? Unlike the chloroquine, 70 years on the market, a miracle drug, okay? They villainize that. You could get paid to go through that clinical trial because there are phases, a whole bunch of money. But instead, when 2020 rolled around, they made you the lab rats for a new drug with something you know nothing about, mRNA. Absolutely none of you know anything about that. But you rolled up your sleeve and you took it. So I'm thinking they need to know that they could have gotten actually paid to do this legitimately. They did a massive rollout on a new experimental drug for free, and it blows my mind. So Reddit says the average payout for research for patients for medical clinical trials, because again, you can get paid for this. You should get paid for it. That's why they exist. This says anywhere from $3,500 to $50,000. Okay, and so I just opened it up. How much money can you make from clinical trials? And we'll just go with this figure here, a conservative 1,000 to 10 grand. Either way, not only did they make you a guinea pig for a new drug you know nothing about, with a survival rate for all of the age groups. You injected your babies, you injected your grandparents and your great grandparents. And look at the rate of survival. The comorbidity was a real thing. If you had other health issues, you might have got taken out by this thing. But look at that survival rate. That was discovered early on. All right? So, yeah, that's what you could have gotten paid. But instead, they enticed you with free, bad for your health. New York offered a hamburger with some fries. I think you got a ice cream in one place in New York, and then what else was it? A cookie somewhere. Yeah, but it's your health. And so I did, just for kicks and giggles. I scrolled on down, and found this one. Do 90% of the clinical trials fail? Yes, they do. Yes, they do. Yes, they do. Despite more than 130 billion in collective spending on pharmaceutical R&D. I don't know what that means. Maybe we'll look that up. More than 90% of all new drugs fail during clinical trials. So they gave you an experimental drug during a time where they created the most massive hysteria I've ever witnessed in my lifetime. Nobody thought this through at all. At all. At all. You had a bunch of actors who had a conflict of interest, by the way. Little footnote. His wife was the head of the department that he worked under, the NIH. Yeah. Unbelievable when I think about it. And as time went on, somebody was smart enough, John Miller, way back in December 2020, rolled this out for everybody to see. I don't know how many people saw it, but apparently not enough. So I guess there was a reason that this little thing popped into my head, and I decided to just show you how much motherfucking money they screwed you guys out of because y'all didn't seem to know. They pay volunteers for their bodies to test new drugs. But because he said so, I just pray that whatever was in those Franken jabs or whatever you want to call them, that they don't come back to haunt you. Because please look at the video that I'm going to link at the end. Yeah, they've been protected, they have immunity, and you gotta wonder, you just have to ask yourself, if the drugs are so effective, then why do they have immunity if they bring you harm? You have more protection under your clinical trials. Maybe. I mean, you might have a disclaimer that, hey, this particular drug might cause death, and if you sign off on it, good luck, you know? But you've got more of an opportunity of doing something that not only won't harm you, I wouldn't put my body up against it, but you can get paid. I know one girl who did this while she was in college. She made about $5,000 doing it, you know? So, food for thought. Food for thought. I will see you next time.